Hello everybody, welcome to our video demonstration for our project Stroke Proof, a visualization based stroke detecting technique. This is our landing page. This is where our users are going to land up. This page comprises of tutorial for how to use our tool and various static images of all the layouts that have been used for this project. This is a static image and does not show the dynamic visualization that we will be using to achieve our goal. So this is our actual visualization page. As you can see that this view comprises of two views. The first one is actual arterial view, that is the image on the left, while the image on the right represents the abstract hierarchical tree structure for our human brain arteries. You can see that both these views are color encoded. On the basis of this legend, you can know that they represent the type of arteries in a human brain. The pink structure here, for instance, represents the LPCA or the left posterior cerebral artery, both in the abstract view as well as the actual view. The abstract view is a hierarchical representation of arteries in the human brain, while the actual arterial view is derived from using the XYZ coordinates derived from the MRI scan of a human brain. We have used different representations to represent various views of a human brain. For actual arterial structure, we have three views. The present view that you can see is the back view, which represents the artery structure of the brain from the back. If you have a look from the back side of the brain, have a look from the top side of the brain, our artery structure is going to look something like this. While if you see our brain from either left or right side of your brain, then the artery structure is going to look something like this. Let's switch back to the back view. Similarly, we have three different views for our abstract tree layout. The original view represents the actual artery structure, and we preserve the branching structure of our whole brain. The other view is symmetry view. One of the major goals of our project was to compare symmetry between left and right side of the brain, which can help physicians to gain context. Like if a problem occurs on the left side of the brain, they can if a brain is symmetrical, using the left side of the brain and the overall architecture of that area, that can derive results for the right side of the brain too, and vice versa. But we wanted to preserve the branching structure, and symmetry view that we represent right now does not preserve the branching structure, and that might lead to some false positives or false negatives. Therefore, we have also designed a hybrid view which gets the best of both the worlds. That means that it also preserves the branching structure as well as is a very good method to compare symmetry. Blood flow visualization that we are going to show for our tool. Here, we have provided a color encoding not on the basis of type of arteries, but on the basis of presence of blood volume. So high blood volume is represented by a dark red color, whereas a low blood volume is represented by a lighter shade of orange. How we have also simulated the blood volume or a blood intensity in our overall visualization, which is like as follows. If the blood flow in the parent artery is F, then the blood flow in the subsequent children artery is going to be F by 2 plus randomized noise. So here, if there is a gradual drop in color, that is gradually the color drops from red to a darker shade of red to a very lighter shade of orange, then that means that there is no blockage in our brain, that is a stroke has not been suffered by the concerned person. So red color is going to be represented at the internal carotid artery or the root of this tree. So here you can see for most of the arteries, the color drop is pretty gradual. But there is one artery where there is a sudden drop in color, which is analogous to sudden drop in actual blood volume, which is right here. That means there's a problem in this part of the brain, and a person has been affected by stroke at this part of the brain. Now, it's easy to determine stroke using this view, but doctors would like to get a special perspective of where that artery is actually present in the actual brain. This is where our interaction comes into picture. If we just click on here, you can see where this artery is present in the overall brain, which is right here. And this is the place in our brain where stroke would have occurred. This is all about our project. Thank you and have a cheerful day.